Good evening, everyone. How are you? I hope you're well. David Johnson here from the Back Pain and Functional Movement Training Centre. This is where I am right now, here at our Brisbane headquarters in Woolloongabba. Tonight I'm just going to answer a very brief but commonly asked question. What is NeuroHAB? Now, as you know, I'm a neurosurgeon with a special interest in spine care and in particular back pain. Back pain is one of the leading causes of disability in our country and globally. And NeuroHAB was born out of the understanding in my practice that throughout the rehabilitation industry, there was not really a resource or a service that allowed people to eliminate the cause of their back pain. And in fact, most people use the term back pain interchangeably as both a symptom and a diagnosis, and that's just not right, because by definition back pain is a symptom, not a diagnosis. And most people who suffer from back pain are really unfamiliar with what the cause of their back pain is, and hence they can go through a large part of their clinical history and never actually implement a management strategy that addresses the cause of their pain. So about 10 years ago is when I realised that there's a major deficiency of this form of rehabilitation within our society, and hence the development of NeuroHAB took place. And the word NeuroHAB itself comes from rehabilitation of the central nervous system motor patterns, and that gives a bit of a clue as to what the rehabilitation program focuses on. It focuses on motor patterns which are derived from our central nervous system, and those motor patterns dictate how we move our body. And one thing that most patients that I talk to do not understand, they've never been taught what the definition of good versus bad movement is in respect to the lumbopelvic spine, because the lumbopelvic spine is the back, so to speak, and the lumbopelvic spine is primarily there to allow us to bend. So NeuroHAB allows us to learn how to bend well in our activities of daily living, and it unfortunately doesn't just boil down to those sort of dogmas that you may or may not have heard of, keep your back straight, bend the knees. That is actually inadequate to allow people to understand how to move the lumbopelvic spine well. And most people who have back pain do not move their lumbopelvic spine biomechanically well. So another way to answer the question about what is NeuroHAB is to sort of explain what NeuroHAB is not. NeuroHAB is not an exercise program. It is not manual therapy. It is not stretching. It is not deep tissue release. It is not core strengthening. It is not a fitness program. It is not Pilates. Okay, all of those are very commonly delivered elements of the rehabilitation industry. Some of those methodologies aim to increase strength and fitness. Others aim to increase flexibility or core strength. And NeuroHAB is not really any of those. NeuroHAB is unique, and its primary goal is to increase the skill of patients moving their lumbopelvic spine in everyday life activities, and as such they are effectively eliminating the disease of movement dysfunction which causes back pain symptoms. Because one fundamental truth is that the most important factor that determines joint health is the way it moves, and no other rehabilitation paradigm defines good versus bad movement. NeuroHAB defines good versus bad movement, and we transfer that awareness and that skill into our patients. And when our patients understand what good and bad movement is, they can then engage in their everyday life activities with A+ movement, and so therefore they are then allowing their daily life activities to be their rehabilitation program. From the very first lesson that they have with NeuroHAB, for the rest of their life, if they apply the movement principles that are taught here, then they will be rehabilitating their back pain, their condition of movement dysfunction, and curing that disease, and therefore eliminating the symptoms of back pain. If you don't address the cause of your back pain, you will continuously need to keep topping up and band-aiding the symptoms of pain with various strategies such as tablets, cortisone injections, lifestyle restrictions, changing functional demands. For example, removing quality of life activities such as sports and leisure, or downgrading job requirements, going on to special suitable duties and things like that. And that's simply because you're not addressing the cause of the pain symptoms. You're just trying to tamponade or band-aid the symptoms of pain. So in a nutshell, I hope that does help people understand the uniqueness and the distinctive place that NeuroHAB plays within the back pain therapeutic industry. You can do those other activities if you like, such as Pilates, massage, deep tissue release, stretching, yoga. All those things are fine. Hydrotherapy, that's fine. But if you ignore the cause of your symptoms, if you ignore the cause of that pain and do not understand movement proficiency and do not reacquire that skill of moving well, then unfortunately you'll very likely remain a statistic of the chronic back pain epidemic. All right, so if you'd like to learn more, and if you'd like to be a part of our rehabilitation program and cure your back pain definitively, cure your movement dysfunction, which causes back pain definitively, then please get in touch with us, and I'd love to see you here. All the best.